afternoon, students. Sphenoid is an irregular pneumatic bone which is located between the ethmoid bone and the orbital plate of the frontal bone in front, the petrous part of the temporal bone and the basiocciput behind. In order to hold the bone in anatomical position, it should be held with both hands, and we should be knowing about the presenting parts and which is in front and which is in back. The presenting parts are, it has two greater wing, two lesser wing, there is one body in front, and these are the pterygoid process below. The pterygoid process should be looking below, the body on the posterior side, the basiocciput, the lesser wing, the concavity of the greater wing on the upward side. This is how the bone should be held in anatomical position. The body is a pneumatic bone which has got sphenoidal air sinus. The features on the superior surface from before backwards are the ethmoidal spine, which are ethmoidal crest, the jugum sphenoidally, the sulcus chiasmaticus, which opens through the optic canal. Next, there is the tuberculum cellae with the elevated portion on both sides as the middle clinoid process, which articulates with the anterior clinoid process forming the carotidoclinoid ligament. Then there is the fossa for accommodation of the hypophysis cerebelli, and finally posteriorly there is an elevation of bone which is the dorsum sphalae, and two elevation on both sides which are the posterior clinoid process and articulates with the anterior clinoid process as the interclinoid ligament. Major features on the inferior surface are the sphenoidal rostrum, which is the continuation of the sphenoidal spine, the horizontal part of the sphenoidal concha, and the vaginal process, which is a horizontal plate of bone, which is originating from the junction of the body with the pterygoid process. The anterior surface of the body presents a sphenoidal crest which articulates with the posterior part of the perpendicular plate of ethmoid, a pair of sphenoidal concha on both sides. The sphenoid in the lower medial part of the sphenoidal concha, the sphenoidal air sinuses open into the nasal cavity through the sphenoethmoid recess. In the upper lateral part of the sphenoidal concha, it articulates with the labyrinth of the ethmoid through a rough triangular elevated area. The lateral surface of the body of sphenoid is where from the greater wing of the sphenoid originates. At the junction of the lateral surface of the body of sphenoid and the greater wing, there is an italicized F-shaped groove which accommodates the internal carotid artery along with its surrounding sympathetic plexus. The greater wing has a superior surface and a lateral surface. The superior surface forms a part of the anterior cranial fossa and accommodates the frontal lobe of the brain. It presents a few foramen from before backwards. They are foramen rotundum, foramen ovale, and the foramen spinosa. Occasionally there may be a foramen between foramen ovale and foramen spinosum, which is known as the canaliculus innominatus. It is not present in this specimen. The orbital surface of the greater wing of sphenoid is quadrilateral in appearance, where the lateral part is articular and the medial part is non-articular. In the lateral part, the upper lateral part articulates with the orbital plate of the frontal bone. Lower lateral part articulates with the orbital process of the zygomatic bone. Upper medial part forms the lower boundary of the superior orbital fissure, and the lower medial part forms the upper boundary of the inferior orbital fissure. The posterior border of the superior surface of the greater wing of sphenoid articulates with the petrous part of the temporal bone medially, and the lateral petrous part of the temporal bone laterally, and medial part is non-articular, which forms the foramen lacerum, through which the internal carotid artery comes upward. The foramen lacerum is bounded anteriorly by the posterior border of the lateral plate and posteriorly by the petrous part of the temporal bone. Behind that there is a sulcus tubi, which accommodates the cartilaginous part of the auditory tube. The lesser wing of the sphenoid is a triangular plate of bone which is attached to the body of sphenoid by means of two roots. Between these two roots, the optic nerve and ophthalmic artery passes, which is known as the optic foramen. Now, in the posterior part of the lesser wing is the presence of the sphenopetrosal spinous and the stem of the lateral sulcus. The lesser wing also gives attachment to the anterior free border of the tentorium cerebelli. Now we come to the pterygoid process. Pterygoid process originates from the lower part of the body of sphenoid bone. The pterygoid process, both the pterygoid process, it gives rise to forms the pterygoid fossa, and the anterior part of the pterygoid process forms the boundary of the pterygopalatine fossa. The pterygoid process has two plates, the lateral pterygoid and the medial pterygoid plate. The lateral pterygoid plate gives attachment to the lower head of the lateral pterygoid laterally and the medial pterygoid medially. And the medial pterygoid plate articulates anteriorly with the lower border, with the posterior border of the perpendicular part of the palatine bone, and the posterior border is free, and there is a hook below which is known as the pterygoid hamulus, along which the tensor veli palatini curves downward and gets attached to the palate as the palatine aponeurosis.